such as ENM, IP, IPDRG. Like that, home health is one of the specialty of coding. In fact, currently it is a growing and highly in demand in current coding industry. So I will tell you the brief introduction about what is actually home health coding and what care they are going to provide in home health. So first point is if a patient is in hospital or any rehab facility, as he recovers, the patient, hospital or physician determines that he is stable enough to go home or not. And but he, if physician thinks that patient needs any skilled monitoring or any medical treatment at home, so they send him to the home health agency. So this is the basic concept behind home health services. So what in home health care involves a team of skilled professionals. They are providing care to the patient at their own home, means patient's home, for any illness or injury or disease or any post-operative care or post-surgical care like that. So these are the professional lives, skilled nursing or registered nurses or physical therapists or occupational therapist, speech language therapist, like that. There are many skilled professionals. They are going to the home, patient's home, and they are giving care to the patients as per physician's plan that we called as a plan of care. Means physician is providing a plan of care to that skilled professional, and they are going to perform all the care at the patient's home. Okay, so in home health coding, means home health coding is a process of translating patients' medical records, different medical records like uh, physicians' referrals, clinicians' notes, oasis documentation, and into a ICD-10 CM course or oasis course. So basically, we are coding only two types of codes, that is ICD-10 CM and oasis codes. So next point is home health services can be provided to any patient irrespective of age. There is no age criteria to improve or maintain their functions, patients, or prevent rehospitalization. So next point is home health services. What is the benefits of home health services? That first is it is less expensive comparative to hospitals, more convenient, and as effective as hospitals or SNF cares. So this is the brief introduction of what home health services. So next point is eligibility criteria. What is the eligibility criteria for the any person who is going to take home health services? So first and most important criteria is patient should be homebound. What is the meaning of homebound? Means patient is able to leave his home, but he requires considerable taxing efforts to leave home, or he needs any adaptive devices, means walker, wheelchair, or he needs someone, means person or caregiver to help him to go outside his home. So basically, means patient is homebound. He is not capable to go outside to the hospital, so he requires home health services. So eligibility criteria includes two, three, or 4 points. If patient what eligible for that criteria, then physician or hospital is sending him to the home health services. So first criteria is if he needs supportive devices or adaptive devices for the ambulation or walking. Second criteria is if patient needs any transportation, special type of transportation, or any assistance of another person or caregiver. This is the second point. Third, if due to any medical conditions he is unable to leave his home, or physician contradicts him to leave his own home. So that is third point. And if he needs any considerable taxing efforts to leave home, then he is eligible for the home health services. So he is eligible or not, this decision is only of physician or any hospital. So Okay. Next point is referral sources from where patient is coming to the hospital, coming to the home health. Means basically patient coming from hospitals. So depending on the type of sources, there are two types of sources. Facility sources and non-facility sources. Patient means any physician referring patient to the home health. Okay, facility sources means different type of hospitals like long-term nursing care, skilled nursing facility, short stay hospitals like that. These are the examples. Another non-facility sources means office visits or wound care centers, outpatient from their patient is coming to the home health services that is that we called as a non-facility sources. And also skilled professional, they are providing care to the patients. For example, I told you already. For example, skilled nurses, registered nurses, and therapists, and all. These are the people who are going to take care of that patient at their own home. And okay, I will tell you the next about types of visit in home health. These okay. Wait a second. I'm going to share my screen. My screen is visible. Hello. Okay.
Yes, it is visible.
Yeah. Okay. So next point is types of visit. Okay. Type of visit means if patient is coming to the hospital, patient is coming to the home health services, then there are different types of episodes. Means for specific time period, patient is in home health, so that is mostly of 60 days. And skilled professional, they are means nurses or therapist. They are giving services to that patient. So there are four types of visits, that is SOC, ROC, REC, and SCIC. SOC means start of care. Okay. Start of care means what? When patient coming first time in home health. So that date is start of care date, and after that 60 days he is in home health. So that is SOC period. Second one is REC. REC means what? Recertification. Means after that 60 days, first episode, if patient wants to continue that home health services, then we called it as a recertification of care, that next 60 days. Now, ROC, resumption of care. Okay, I will tell you, if patient is in home health for 60 days, in between that 60 days, if patient re-hospitalized for any reason, for any condition or any disease, and after hospital discharge, he is again coming to the home health. So that time, any nurse or clinician or therapist are going to visit patient's home. That visit we called it as a resumption of care, means re-hospitalization. If again hospitalization happens in between the SOC or REC period. Okay. So this is all about the basic of home health. And okay, I will tell you about BCHSC. BCHSC is the mandatory certification required for the home health coding, means board certificate of home health coder. So basically, format of 100 question. It is online exam for 5 hours, and passing score is 80%. Okay. Next, exam focus means syllabus of that exam is basically ICD 10 cm guidelines and chapter specific guidelines, anatomy and physiology, basic anatomy and physiology, then home health clinical documentation, and oasis. Oasis is a separate part of home health. I will discuss that later. Okay. Then, that bifurcation of marks of that means questions, 85 marks for only diagnosis or ICD 10 cm guideline or coding related guidelines. 85%, oasis for 5%, anatomy, physiology, health information documentation, that is for 5%, and regulatory or compliance related any questions, that is for 5 marks. Okay, validity, this certification valid for 3 years. And material means they are providing books at the center at the time of exam. There are different books of home health and hospice, means ICD 10 cm, home health and hospice, different set of books they will provide. Okay, if anyone have any doubt or any question,
No, ma'am.
no, anyone want to ask anything? Okay, then
No.
next I will show you. And this is my schedule. I prepared that ICD. We will discuss ICD and oasis. This is the important part of our training. ICD actually guideline, convention and guideline. After that, 21 chapters specific guideline. Okay, I okay. I will cover all that first. After that, oasis. These are the oasis items. Um, after ICD, we will cover oasis, and after all the lectures, I am planning 45 lectures. Only on Monday to Friday. Saturday, Sunday is off. Means it will take approx 2 months. After all ICD and OSS, I will discuss these live charts, exam papers, and I will provide you question bank for your Saturday or Sunday. You can practice on that. So, and one more point, important point in home health is the query process. Hold process or query process means if we have any doubt or anything, we can ask to clinicians, or we can send query and they will reply. So, I will discuss that also at the end. Hmm. And next, I will share with you that ICT guideline PDF and OASIS manual. Second, no, I'm not so.